So did you know that your gut and your brain are basically best friends?
What? Did we just become best friends?
Yup! They're always talking, they're always chit-chatting. However, if one is acting a fool, the other one's gonna act a fool as well. So in today's video, I'm gonna give you 5 things I want you to know about the brain-gut interaction. At the very end of the video, I'm gonna tell you how you can use this relationship to your advantage to get you feeling better. Guys, let's talk about food. Howdy, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with all sorts of GI issues. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and come see us up at Gastro for all your GI needs. And if you can't, consider subscribing to my newsletter where I can give you great tips and tricks to help out when it comes to your gut health. So the brain-gut axis is real. I have a lot of videos on this, and this is actually one of the biggest drivers when it comes to gut issues. For example, irritable bowel syndrome, dyspepsia, inflammatory bowel disease, Crohn's and ulcerative colitis, heartburn, reflux, pretty much any GI issue that you have. One of the reasons is that it could be driven by the brain-gut axis, the superhighway between the brain and the gut. Here are 5 things I want you to know. Number 1, when you are stressed, your gut will be stressed as well. And this is a real phenomenon. So have you ever noticed in times when you're stressed, like maybe you're filming a YouTube video, all of a sudden you gotta use the restroom, you gotta fart, you gotta pee, you gotta poop. Oh my goodness, what is going on? That is the direct connection between the brain and the gut, and it is real. So the more stress you are up here, the more stress you're gonna be inside your gut, because it's the direct connection between the 2 areas. You have the release of neurotransmitters, you have the increase in hormones. All of these things will change the contraction of your gut to cause you to either be constipated, diarrhea, have butterflies, or have abdominal pain. And same thing vice versa as well. For a lot of my patients have a lot of GI issues. Their GI issues can totally stress them out, which makes sense. Their lives revolve around, when is my next bowel movement? Am I gonna make it in time? Where's the restroom at? And that can cause a lot of stress and anxiety in their life. And so there's a direct connection between the 2. The more stressed you are with your gut and your brain, the more stressed you're gonna be vice versa as well. So sometimes it's a matter of us trying to break that connection to help you to deal with your issues. Number 2 is anxiety can actually worsen a lot of gut issues as well. Let's use the example of IBS. I have a lot of patients, thousands of patients who have treated with IBS. And sometimes we can do dietary options, sometimes we can try lifestyle changes, sometimes we can do medical therapy. But for some patients, that does not work because the anxiety is driving their gut issues. They're either depressed, they're anxious, they have a lot of things going on in their life. And so for some of these individuals, I actually may not treat their gut issues specifically. We actually may directly treat their anxiety, whether it's medication like amitriptyline, Elavil, Remeron, Prozac. These medications actually are used to treat depression, but surprisingly, they actually work very well when it comes to GI issues. And so we use these commonly in very low doses and titrate them up, and you'd be surprised how many individuals feel better. And I think it's important for us as doctors to use these medications early in the process. And so I'm very quick to suggest these medications, especially if I have an individual that I can see is very stressed, has a lot of anxiety, and we can't find ways to deal with that in other mechanisms. And it's okay. I don't want you to be ashamed that you have to take something like that because it's perfectly fine. And sometimes we need that boost. And what I tell my patients is that there's an opportunity for us to maybe get you off these medications to get you feeling better depending on how your body feels. And that's okay. Number 3, your mood can also affect your bowels as well. And so I have a lot of individuals that actually have depression as a diagnosis, and because they're depressed, they actually cannot use the restroom. They become constipated. So depression and low moods can actually slow things down. It can make you more constipated. It can make you have more reflux, more abdominal pain, more bloating, because things are not going through. Everything is slowed down when you're not feeling good, when you're depressed all the time. And so once again, on the same route, when it comes to anxiety, we will use medications that can enhance your mood that actually may have a side effect of causing your bowels to move more frequently and more often. So we're trying to get 2 things with one medication, which actually works effectively when it comes to GI issues. And number 5, keep in mind, it's a two-way street. So if you have a lot of gut issues, you're gonna have a lot of anxiety sometimes. If you have a lot of gut issues, you may feel depressed all the time as well. So I'll give an example. I have a very young patient that's very stressed about school. She's worried about whether she's gonna get into a graduate school. She's worried about how her friends think. She can't go out anywhere. And that caused her to have a lot of stress. And that stress also is affecting her gut. She can't use the restroom. She's always bloated all the time. She's always bloated. She doesn't feel good. And that also makes her more stressed. And so it ends up being this cycle between her anxiety, her gut issues, her anxiety, and her gut issues as well. So if you're having issues like this, or this sounds familiar to you, here are some steps that I recommend. Number 1, talk to your doctor about whether you can get some medical therapies to get you feeling better. You need to sometimes ask for this because sometimes we're not aware of what's going on in your life. Unfortunately, when it comes to the healthcare system in the United States, we have a certain amount of time that I can spend with you, and you have the rest of the time you can spend with yourself. So I want you to be proactive about your health and ask your doctor or your healthcare provider, hey, should I be on something to help out with my mood? Or can you help me out with my depression or anxiety? I may not know what's going on, and I want you to be proactive about that. Number 2, use nature's way to get you feeling better. There are so many studies that suggest that something as simple as exercise can enhance your mood. It can make you feel better. It can get you out of depression funk. In fact, it's one of the cornerstones of therapy when it comes to actual depression. And so if you are having these issues and you are not exercising, get out there and get going. I'm telling you as your doctor, it's effective, it works, and most importantly, it's free, and it's nature's way to enhance your mood. I am so surprised about the research on how beneficial exercise is when it comes to mental well-being. So use this as a way to get you going. Number 3, find ways to help de-stress and relax. I'll use myself for example. So I meditate, I read, I journal. These things help to minimize my stress to get me feeling better. In fact, I actually schedule a time about 30 minutes before I go to bed, which is called my stressed out time. And during this time, I write down everything that's bothering me. I get it on paper, I write it down, I put everything that's down. And I was actually surprised how effective this is. It's just literally listing everything that's down that's stressing me out because I get it out of my head, I put it on paper, and I just forget about it. And if I, for some reason, come back to it, I think to myself, okay, I've already discussed this. I've already reviewed this. I've already put it down. I don't need to worry about this anymore. And then lastly, maybe get professional help, and that's okay. Cognitive behavioral therapy or gut-directed hypnotherapy has been shown as an effective therapy when it comes to gut issues. I try to recommend this as much as I can. There are online instructors, or there may be people in your area, but finding a therapist can be one of the most effective ways when it comes to dealing with your gut issues to get you feeling better. So keep in mind, the brain-gut connection is real, and it can affect how you feel when it comes to your GI issues. I promise you, you're not crazy, and I promise you, you're not alone. Now, if you feel like you're having issues with your gut, come see us at Gastro. We can find out what's going on, get to the root cause, and get you feeling better.